Hello everyone, welcome back to my channel. So as I promised, I'll take session from 7 o'clock to 9 to us, 7 to 8, 8 to 9, then from 9:30 to 11. Another to 10 to 11. So another 1.5 hours. So daily we'll have 4 hour session, but today I got quite late. Okay, but now let's just begin the session. So today Okay, so today we'll try to, complete the forensic remaining portion of asphyxia. So yesterday I couldn't complete the session because of some technical issues. But today we'll try to cover in detail. So we were discussing mechanical asphyxia. Okay, so by 10 of May, I will try to conclude with the forensic medicine. Okay, so the topics we'll be discussing is today what we will be discussing is the asphyxia, mechanical asphyxia, thermal deaths, mechanical injuries, and postmortem changes if it's possible. Okay, beginning with the mechanical asphyxia. Okay, this chapter is really important and high it's a high advantage studying this because this helps in autopsy. Okay, so we were discussing about hanging. So hanging is of two types, typical and atypical. What is hanging basically? It's caused due to suspension of the body. Here the body is suspended. Now causes of death is in asphyxia. In asphyxia causes of death in hanging is due to asphyxia, venous congestion, combined asphyxia and venous congestion, cerebral anemia, reflex vagal inhibition, fracture or dislocation of the cervical vertebra, delayed death, fatal period, postmortem appearances, that is external appearance, that is the mark of the ligature with the multiplicity, weight of the body and the degree of extension, tightness of encircling ligature. This is what we have discussed. We have discussed about slip knot, running loose, tight knot. Okay. So description of ligature mark we have seen, fixed loop we have seen. So today's topic will be discussing about the other part, that is strangulation. So now let's discuss about the strangulation. So hanging is mostly suicidal. Hanging is mostly suicidal. So here you will find the calm environment with a letter, with a suicide note. You will find a suicide note here. Here you will find a suicide note. Suicide note in hanging is there. Okay. So in hanging, talking about the signs of asphyxia in hanging. Okay. The signs of asphyxia are most marked in cases in which the noose was placed high up on the throat. Slow asphyxia is the exception in hanging and is likely to occur only when the point of suspension is a low one. A ligature exerts pressure below the chin and does not encircle the neck. Suspension is complete or in the standing posture, asphyxial signs are minimal and particle hemorrhages are less common. In incomplete suspension, asphyxial process is slow, face dusky, purple, congested and often swollen. So you'll find petechial hemorrhages. Petechial hemorrhages is due to rupture of small capillaries. Okay, pinpoint rupture of the capillaries causes the petechial hemorrhages. So dusky, purple face, congested and swollen. Other signs is in death due to vagal inhibition or injury to spinal cord. Face will be pale. If the body has been suspended, face will be pale. If death is due to vagal inhibition, then face will be pale. If the body has been suspended for some time, postmortem lividity is seen in the lower limbs and hands, while the upper part of the body will be pale. Because of gravity, everything will go and settle down. So the lividity will be seen in the lower parts like limbs, hands, and legs. Okay. Petechial hemorrhages may be found in the skin of the legs. The neck is stretched and elongated, and the head is always inclined to the side opposite to the knot. See, if the knot is at the left, um, then the head is the if knot is left, then head is right. So opposite. So the head will be inclined to the opposite side. Okay. The face is usually pale, but is sometimes congested and swollen due to leakage of edema fluid. Due to leakage of edema fluid. Due to leakage of the edema fluid. The face is usually pale but is sometimes congested and swollen due to leakage of edema fluid into soft tissues. If the veins were constricted before the arteries, the eyes are frequently protruded and firmly, and conjunctiva usually congested. The eyes are closed or partially open and the pupils are usually dilated. The eyes are closed or partially open. The eyes are frequently protruded and firmer, and conjunctiva usually congested. You will see the red conjunctiva, the eyes are red conjunctiva is red because of the congestion. If the ligature knot presses on the cervical sympathetic, the eye on the same side, if the ligature is compressing the cervical sympathetic ganglion, then the eye on the same side may remain open and its pupil is dilated. Same side, which side is compressed, that side the pupil will be dilated. This is called Lee Facey sympathetic. It indicates antemortem hanging. It indicates that the patient was antemortem hanging. It indicates antemortem hanging. The tongue is usually swollen and blue, especially at the base, and usually forced against the teeth when the jaw is shut. The tongue is usually swollen and blue, especially at the base, and usually forced against the teeth when the jaw is shut. Or the tip may be found projecting between the lips. The lips and the mucous membrane of the mouth are blue. Saliva may be found dribbling from the angle of mouth when the head is drooping forward. This is due to increased salivation before death due to stimulation of salivary glands by the ligature. So when the ligature is compressing the mandibular glands, the saliva will droop out of the mouth. Slight hemorrhage or a bloody froth is sometimes seen at the mouth and nostrils. Froth may be seen. Bloody froth is sometimes seen at the mouth and nostrils. The hands are clenched, especially in violent hanging. Engorgement of the penis with blood occurs from hypostasis. It may be semi-erect and semen may be found at the tip. Urine and feces may escape due to relaxation of the sphincters. But if this happens when the body is for a long time hanging, okay? Internal, the neck should be examined after removal of the brain and viscera from the chest and abdominal cavities. So neck, see, if you find that there is a ligature mark or something and you suspect that the death of the body of the patient, of the victim is due to the hanging, then the neck should be examined after removal of the brain and viscera from the chest and abdominal cavities. First, clear the chest and abdominal cavities, remove the brain, open the skull, and the tissues under the mark are dry, white and glistening with occasional ecchymosis in the adjacent muscle. The muscle of the neck, especially the platysmus and sternomastoid, are ruptured if violence has been considerable. Hemorrhages in strap muscles are present about 24%. In some cases, 5 to 10%. The intima of the carotid arteries show transverse splits under the groove, usually around the region of sinuses, with extravasation of blood in their walls due to stretching and crushing. The vertebral arteries show ruptures, intimal tears, and subintimal hemorrhages in some cases. Injury to the trachea is unusual. Petechial hemorrhages may be found on epiglottis in the larynx and trachea. Trachea is usually congested. The lungs are congested, edematous, and exude bloody sedum on section in cases of constriction occurring at the end of expiration, but they are pale if constriction occurred at the end of inspiration. Subpleural ecchymosis may be found. The abdominal organs are usually congested. Abdominal organs are usually congested. The brain is usually normal. Subarachnoid effusion are common. Okay, so fracture of hyoid bone and thyroid cartilage. Opinion varies regarding the frequency of fracture of hyoid bone. Estimates ranges from 0 to 60%. The average is 15 to 20%. Fractures are rare below 40 years because of the elasticity of the cartilage and mobility of the joints. The fracture is common in persons above 40 years and involves the great horns at the junction of inner 2/3 and outer 1/3. The superior horns of the thyroid may be fractured in about 40% of cases above 40 years. So, hyoid bone fracture and thyroid cartilage fracture. So, hyoid bone fracture is usually rare because if the victim is less than 40 years, then the hyoid bone is not a bone, it is still cartilage. If it is still cartilage, it is elastic, and because of the mobility, it will not get fractured. The fracture is common in persons who are above 40 years, and it involves the fracture of the great horns of the hyoid bone at the junction of inner 2/3 and outer 1/3. The superior horns of the thyroid may be fractured in about 40% cases above 40 years. Superior horns of thyroid may also be fractured who are above 40 years. Diagnosis: ligature mark around the neck will be there in hanging. Presence of abrasions, ecchymosis, and redness about the ligature mark. Trickling of saliva from the mouth, ecchymosis of the larynx or epiglottis, rupture of intima of the carotid, congestion hemorrhages in lymph nodes above and below ligature mark. Absence of any other cause of death and postmortem signs of asphyxia. What are the postmortem signs of asphyxia? Petechial hemorrhages, congestion. Okay. Other signs like ligature mark will be there. Low face is sympathetic can be there, but it is not very common. It is not very common. When cervical sympathetic is ganglion is compressed, then only low face is sympathetic is seen. Venous congestion, asphyxia, combined asphyxia and venous congestion, cerebral anemia, reflex vagal inhibition. If there is delayed death even after hanging, if the patient is failed, but he will die due to complications of hanging. It is aspiration pneumonia, infections, edema of lungs, edema of larynx, hypoxic encephalopathy, because the artery was compressed, the jugular vein was compressed. So because of that, the oxygen was not reaching. Abscess of brain, infarction of brain, cerebral softening, the patient will not survive. Fatal death. Death occurs immediately if the cervical vertebrae are fractured or if the heart is inhibited. Cervical vertebra is fractured means sudden death will occur. Okay, that's why in judicial hanging, cervical fracture type of hanging is there, in which the person is supposed to be hanged is on a higher platform. Okay, and the rope is long. Okay, so after keeping the rope and covering the face, okay, what happens? Suddenly the platform is lowered. As the platform is lowered, the person suddenly falls and the rope gets tightened and there is a fracture of C2 vertebra. The person dies at the spot. Okay. Fetal period death occurs immediately if the cervical vertebra are fractured, but if the heart is inhibited rapidly, if cause is asphyxia, and least rapidly if coma is responsible. Usual period is 3 to 5 minutes. See, when the ligature mark is not seen, when the ligature is wide and soft, the ligature mark may not be seen or it might be light. Sometimes 2-3 circles of ligature will be there. 2-3 rounds of ligature. So it's very dangerous. Hanging is a bad idea. Okay. Suicidal hanging is common, but accidental hanging is also seen in workers who are hanging with the rope and doing the painting or work on tall buildings. It is seen in children who are playing or with the rope or some ligature. Now let's move on to another topic. Before that, I want to cover one point, that is circumstances of death. See, accidental hanging, it is seen in children during play while imitating judicial hanging or in athletes who are in the habit of exhibiting hanging. Some padding between ligature and neck suggests accident. Workmen in falling from scaffolding may be hanged by becoming entangled in ropes. When boys climb trees or railings, they may lose their foothold, and in falling, some garment is caught by tree branch or bar and is drawn tight around the neck. A person who slips when descending a ladder may be suspended by one of its rungs, or a slip on a staircase may result in suspension on the edge of one of the treads. It may be associated with abnormal sexual behavior. This we'll discuss in detail. Suicidal hanging. Hanging is a common method of committing suicide. In most cases, the body is found in a completely suspended position with the ligature tied to a beam, nail, hook, window, casing, branch of a tree, etc. The body must be in a position compatible with self-suspension. Complete suspension of the body in the absence of any platform is unusual in suicide. Unusual positions, example, where the parts of the body touch the ground, kneeling or reclining are almost diagnostic of suicide. The hands and feet are sometimes tied by the victim before hanging himself. The position of the ligature with reference to the knot and the manner in which it is attached to the support must be compatible with the self-suspension. Blindness or age do not prevent hanging. A person with tracheostomy can commit suicide by hanging as a death occurs due to vagal inhibition. Sometimes hanging is adopted as a last resort after other forms of suicide. Example, cutting the throat or wrist, stabs, firearm wounds, ingestion of poison, etc. have failed to produce death. Suicide pacts affected by hanging are rare. If any external injuries are present, the doctor must decide whether they are self-inflicted, occurred during convulsive phase preceding death, reduced when the body was cut down, or occurred and the swinging body contacted other objects or during attempted resuscitation or homicide. Homicidal hanging, it is extremely rare. It is difficult for a single assailant to carry it out unless the victim becomes unconscious by injury or by a drug, or is taken unawares, or is a child or a very weak person. Homicide should be suspended where there are signs of violence or disorder of furniture or other objects, where the clothing of the deceased is torn or disarranged, where there are injuries either offensive or defensive. The knot is tied to the back of neck. Mouth is gagged. Limbs are tied. Evidence of stupefaction by drink or drugs. In all doubtful cases, circumstantial evidence is important. Person might be ligature strangled and then hanged. In this case, the ligature marking will not have the classic inverted V configuration of hanging. Suspension of body after death, post-mortem hanging. The Sushant Singh Rajput case is a mystery, right? Many people they are still confused whether it was a hanging or a homicide. A person might be ligature strangled and then hanged. In this case, ligature marking will not have the classic inverted V configuration of hanging. If my audio and is fine, can you please give a thumbs up? If my audio is fine, can you please give me a thumbs up? Comment fine. So today we'll try to cover the mechanical asphyxia and postmortem changes if possible. Because mechanical asphyxia is a broad chapter if we study in detail. Okay. Strangulation, types of strangulation. Before that, we have to cover lynching also. The name is derived from Captain William Lynch. This lynching is usually asked as a short answer or very short answer or as a multiple choice question whether the lynching is a homicide or suicide. So it's lynching is a homicide. It's a crime done by a person to kill another person who used to order. William Lynch used to order hanging on the spot without trial in USA, where a black rapist was used to be lynched by angry white mob with a view to teaching others a lesson for committing an offense. Is homicidal hanging. Sometimes a person suspected to be involved in murder, rape, dacoity, etc. is overpowered by a mob and is hanged forcibly from a tree, etc. So in lynching, if any person is suspected, even though the exact proof is not there, when a trial has been done, the person was hanged in front of the public. So that is lynching. Judicial hanging, legal death sentence is carried out by hanging the criminal. Legal death sentence is carried out by hanging the criminal. The face of the person is covered with a dark mask and he is made to stand on a platform above trapdoors, which open downwards when a bolt is drawn. A rope to allow a drop of 5 to 7 meters according to the weight, age and build of the person is looped around the neck with a knot under the angle of the jaw. On drawing the bolt, the person drops the length of the rope. The sudden stoppage of the moving body associated with the position of the knot causes fracture dislocation at the level of second and third or third and fourth cervical vertebra. Bilateral fractures of either the pedicels or lamina of the arch of the second, third or fourth cervical vertebra may occur. That is hangman's fracture. Because the person hanging, it's a hangman's fracture. The upper cervical cord is stretched or torn across. It results in immediate unconsciousness, but heartbeats and respiratory movements may continue up to 10 to 15 minutes. Spasmodic muscular jerking may occur for a considerable time. Asphyxial signs are not seen in properly performed judicial hangings. Suspension of body after death, post-mortem hanging. Look for signs of dragging to the place of suspension. So look for signs. How do we identify whether the person himself got suicide and got hanged or somebody else as a homicide? Drag the person and got the person killed the person and then hanged it to simulate that it's a suicide. So when a dead body is suspended, the rope is usually tied first around the neck and then around the beam, branch of a tree, etc. The beam shows evidence of rope have moved from below upwards as the body has been pulled up. In true suicidal hanging, the rope moves from above downwards. Further, fibers from the rope may be found on the hand of the victim in suicidal hanging, but not in case of post-mortem hanging. Most cases, the internal signs are clearly not those of hanging, although in most cases, ligature mark cannot be distinguished. So the person himself is tying the rope and everything. So the fibers of the rope will be found on the hand of the victim. Okay. Strangulation. Types of strangulation. Strangulation by a ligature, manual strangulation or throttling, garroting, mugging, barnstormer. Strangulation, there is no suspension of the body. There is no suspension of the body, but there is asphyxia. Okay, ligature strangulation. Ligature strangulation is that form of asphyxia which is caused from constriction of the neck by a ligature without suspending the body. Here there is a ligature used in ligature strangulation, but there is no suspension of the body. Suspension of the body is seen in hanging. So here in ligature strangulation, the cause of death may be due to asphyxia, because the person is not able to breathe, cerebral anoxia or venous congestion, jugular vein congestion, or carotid artery constriction, combined asphyxia and venous congestion, vagal inhibition. Ligature. The ligature may consist of a wide variety of objects such as cords, wires, ropes, belts, scarves, ties, towels, stockings, bed linen, etc. Postmortem appearances. External. The ligature mark. The appearance of a ligature mark on the neck varies considerably depending upon the nature of the ligature, amount of resistance offered by the victim, amount of force used by the assailant. So, the postmortem appearance, when the person is dying by strangulation, how will be the external appearance? You might see the ligature mark. The appearance of a ligature mark on the neck varies considerably depending upon nature of ligature, amount of resistance offered by the victim, and amount of force used by the assailant. Okay, it depends upon the force the victim has used to kill, the amount of force used by the assailant, the criminal, to strangulate the victim, or the amount of resistance offered by the victim if the victim was alive or if the victim was conscious. Okay, how much resistance he offered. Depending upon that, ligature mark will be there. It is usually a well-defined and slightly depressed mark at any level on the neck, but usually toward the middle or below the thyroid cartilage. So it's usually below the thyroid, whereas in hanging it is above the thyroid cartilage. The mark completely encircles the neck transversely, but is more prominent at the front and sides than at the back. The ligature mark is more prominent at the front of the neck and sides of the neck, because in strangulation there will be complete ligature mark, more prominent on the front and sides, but in hanging the ligature mark is incomplete. The skin of the front of the neck is more likely to be damaged by ligature than the thicker, tougher skin at the back of the neck. If a knot has been applied, there may be a wider area of bruising at the site of the knot. As the ligature has been tightened by pulling on the cross ends, the marks reduced where the two ends will be different levels. Multiple turns produce complex marks in which it may be possible to trace the number of turns, but a complex ligature composed of several pieces knotted together may produce a mark which stimulates multiple turns, though there was only one. Okay. Rarely a narrow wire may be used. So this is called cheese cutter method, because if a narrow wire is there, it will cut the skin and all like a cheese. Okay. When a narrow ligature, example a cord wire or thin rope is used, the ligature mark is slightly narrower than the actual diameter of the ligature itself. So cord wire or thin rope is used. The ligature mark is slightly narrow. The actual diameter of ligature itself. The ligature is still in position when the body is examined. It may appear to be deeply embedded in the skin, and on removal, a deep groove may be seen in the skin. The embedding may be increased by edema of the tissues, especially above the ligature, which initially may not have been applied so tightly. Strong pressure may lacerate the skin or cut into deeper tissues and cartilages. When a folded cloth has been used, there may be great difference between appearance of the neck mark and the size of ligature. When fabric is pulled tight, certain parts of it become raised into ridges which form the ligating surface, and only these may be reproduced on the skin. When nylon, silk or turlin fabrics are used, they may leave a mark only 2 to 3 mm wide. The mark may be oblique as in hanging. If the victim was sitting and the silent applied ligature on the neck while standing behind him, thus using the force backwards and upwards, or if the victim has been dragged by a cord after he has been strangulated in a lying down posture, the base of the mark is usually pale. There may be exudation of tissue fluid from the which later dries, forming a stiff film. Vertical hemorrhages are usually found immediately adjacent to the ligature mark, which is confirmation that the mark was made during life. So, if the person was alive, the vertical hemorrhages will be there just just adjacent to the ligature mark, just close to the ligature mark. Okay, it's confirmed that the victim was alive during this incident. Reddening and congestion is also immediately above the and below the groove due to squeezing out of the blood by pressure. This does not necessarily indicate the ligature was applied during life. The base becomes dry, hard and parchment-like several hours after death if the skin has been absorbed. The pattern of the ligature may indicate the agent, example woven belt, plaited electric wires, links of chain, spiral rope patterns, etc. For rough ligature, example, a rope is used and if there is some movement of the rope on the skin during a struggle, the skin may show marked abrasions and hemorrhages, and the deep muscles of the neck are grossly bruised. A ligature mark may be interrupted at the front by presence of the clothing or by the victim's finger. Okay, because the victim will try to, take out the ligature mark in an attempt to put the ligature mark. So if the ligature used is a soft and moving, example a towel, scarf, etc., that's removed soon after the mark in the neck moving slight eruption. The deep muscle of the neck may show little or no bruising. The ligature mark of strangulation is not obliterated by putrefaction, but is better preserved than the skin beyond it because of compression. Even if the mark is obscured, subcutaneous hemorrhages in relation to the mark may be found. The description of ligature mark: depth, width, direction, raised, ridges of skin, zones of hyperemia, presence of duplicate strangulation marks, dyed excoriation due to slippage of the implement, marks due to textile wave pattern and structure, distribution of peticulates in the skin, bruising, scratch marks, blisters in the strangulation marks should be noted. So depth, width, directional raised ridges of skin, zones of hyperemia, everything should be noted. What is the depth? What is the width? What is the direction? Is there any raised ridges of skin, zones of hyperemia, presence of duplicate strangulation mark, dyed excoriation, slippage of the marks due to textile wave pattern, peticulae in the skin, how it is distributed, bruising, scratch marks, blisters and strangulation marks should be noted. Pseudo strangulation. In the strangulation, you will find nail marks of the victim because the victim will try to pull out the ligature. Pseudo-strangulation. Occasionally, depressed marks are seen on the dead bodies of infants and children in whom the neck is short. These marks are produced from folds in the skin due to bending of the head. In the elderly, pale crease marks may be seen due to overlapping rolls of skin, especially when head has been propped up with a pillow. It can also be seen in decomposing bodies with a tight collar, button shirt, or at the neck or other clothing around the neck. In these cases, a deep groove simulating, like it's a mark of strangulation, is with the swelling of the tissue around the tight fitting garment. The body decomposes. So the infants they have short necks, so it's always bent. So because of that, there can be some magneto mark like appearance. In older people, also the skin folds might be mistaken as magneto mark. Decomposing bodies because of tight collar or shirt or any garment. Then it simulates the ligature mark, but it's not actually the ligature mark. Have you seen for other signs like particular images? Signs of asphyxia. If there is a slight vagal effect and some venous constriction, there will be slight congestion of head and neck, and occasional particular hemorrhages with moderate venous constriction and some respiratory obstruction. Asphyxial signs are moderate, and constricting force is great. These signs are marked. Intense congestion and deep cyanosis of the head and neck is seen. What are the signs? What are the signs here? Signs of asphyxia. There is a slight vagal effect and some venous constriction. There will be slight congestion of head and neck and occasional petechial hemorrhages, moderate venous constriction and some respiratory obstruction. Asphyxial signs are moderate. Okay, we'll discuss this in detail after a short break of 2 minutes. Okay, what is the doubt, Abhigyan? Can you please type your doubt, ma? Okay, what is the doubt, Abhigyan? You can ask your doubt in the chat section if it is okay. So, after a break of 2 minutes, we will resume the class. You can have your snacks and water. Okay, welcome back after the break, short break. Okay, now let's discuss about the pseudostrangulations. Okay, what are pseudostrangulations? Guys, if you have any doubt, you can drop your question in the comment section. As soon as I will see, I will reply it. Okay, you will get a notification or message regarding it. Okay, so stay till the end of the session. Don't forget to subscribe, like, and share. Share with your friends. If we have a good community, we can discuss more. Okay, so let's move on to ligature strangulation. In ligature strangulation, how will you differentiate whether it was a pseudo strangulation or a strangulation? You see, in case of children, small children's infants, they have a short head, a short neck. They have a short neck. Because of that, the skin pores are there. Because of bending of the head, there is darkening of the skin at the region, and because of that, it looks like a ligature mark due to strangulation. But it is not a ligature mark. It is just because of the skin folds. Similarly, in elderly patient, pale creases are seen due to overlapping of rows of skin because skin becomes loose now because of that overlapping of skin. You can see. It can also be seen in decomposing bodies with a tight collar. If the collar is tight, if the clothing is tight, then because the button of the shirt at the neck, you can see a ligature mark. These are all the pseudo strangulation. Okay, pseudo strangulation ones. What are the signs of asphyxia? I'm audible, right? Okay. Signs of asphyxia. If there is a slight vagal effect and some venous constriction, if there is a slight vagal effect and some venous constriction, there will be slight congestion of head and neck and occasional petechial hemorrhages. If there is a slight vagal effect and some venous constriction, there will be slight congestion of head and neck and occasional petechial hemorrhages. Okay. With moderate venous constriction and some respiratory obstruction, asphyxial signs are moderate. If there is a moderate venous constriction, then asphyxial signs are moderate. If there is a slight vagal effect and slight venous constriction, then slight congestion and slight petechial hemorrhages can be seen. Then constricting force is great. So signs are marked. Okay. Intense congestion and deep cyanosis of head and neck is seen. The face may show bluish patches and is swollen. Eyes are wide open, bulging and suffused. The pupils are dilated. The tongue swollen and often bruised, dark colored and protruded. Petechial hemorrhages are common into the skin of eyelids, face, forehead, behind the ears, and scalp. Blood-stained froth may escape from the mouth and nostrils. There may be bleeding from the nose and ears. So if there is a huge constricting force, then cyanosis can be seen, cyanosis of head and neck. Intense congestion, the eyes are wide open, the conjunctiva is congested and red. Face is bluish, swollen, bulging and suffused. Pupils are dilated, tongue is bruised, swollen, dark colored, and it is out, touching out of the lips. Yeah? You have seen the typical strangulation, like the tongue will be outside, eyes are congested, red, swollen, open, and face will be having bluish discoloration with petechial hemorrhages, dot, you can see on the face. Okay, petechial hemorrhages are common into the skin of eyelids, face, forehead, behind ears and scalp. Blood-stained froth may escape from the mouth and nostrils, and there may be bleeding from the nose and ears. Okay. Hands are usually clenched, genital organs may be congested, discharge of urine, which is seminal fluid. These external signs may be absent if the death occurs quickly from vagal inhibition. So these external signs are absent if death is due to vagal inhibition. due to pressure on vagal inhibition when it happens, and there's a pressure on the carotid sheath. In the carotid sheath, we have vagus nerve also. So if that is compressed, then because of vagal inhibition, sudden stoppage of heart will be there. A sudden compression of windpipe causes almost immediate unconsciousness and death. Windpipe is what? Trachea. If trachea is congested, it's compressed, then immediate unconsciousness will be there. The patient will become unconscious. Now he can't do anything. He or she, the patient victim cannot do anything. He's unconscious. Okay. What are the internal findings? There may be superficial hemorrhages under the ligature mark. Superficial hemorrhages you can see under the ligature marks. Though this is often minimal, there is severe congestion and hemorrhage into the tissues in and above the area compressed. The adjacent muscles of the neck are usually lacerated. The muscles are lacerated, torn. In some cases, no external mark is seen on the surface of the neck, but extensive bruising of the deeper tissues may be found. The extent of bruising depends upon the degree of pressure used. The ligature which is tightly applied on the neck until death occurs must fail to produce any bruising. The intima of carotid artery is not usually damaged, but a deeply sunken narrow ligature applied with force may damage the carotid artery also. If it is narrow, because it will compress the deeper structures also, and if it is with a great force. Bruising of the root of the tongue and floor of the mouth may occur. Bruising of the root of the tongue and floor of the mouth may occur. Hemorrhage may be seen under the mucosa of the larynx, especially beneath the vocal cords. These hemorrhages are larger than petechial hemorrhages, asphyxia. The larynx, trachea, and bronchi are congested and contain porosity, often blood-stained mucus. Subcapsular interstitial thyroid hemorrhages are common. See, the important points I repeat twice and thrice, and the points which are not very much important, I am not going to repeat it many times, but the points which are must to be known, that will be repeated several times, okay? So hemorrhages may be seen under the mucosa of the larynx. So if you open the larynx, you see the congestion and redness, right? Especially beneath the vocal cords. These hemorrhages are larger than petechial hemorrhages of asphyxia. The larynx, trachea, and bronchi are congested, contains frothy, often blood-stained mucus. Okay, froth is formed by blood and air. Okay. When we discuss drawing, we can discuss in detail how froth is formed. Subcapsular interstitial thyroid hemorrhages are common. Subcapsular and interstitial thyroid hemorrhages are common. The lungs are markedly congested and show ecchymosis and larger subpleural hemorrhages. Silvery looking spots under the pleural surface due to rupture of the air cells, which disappear on pricking, are seen in more than 50% cases. Silver looking spots under the pleural surface. You have the pleura. Pleura is the outer covering of lungs. Okay. The pleural surface, they show silvery looking spots due to rupture of the air cells, alveoli, okay, which disappear on pricking, are seen in more than 50% cases. Pulmonary edema is present. The parenchymatous organs show intense venous congestion, and in young person, ecchymosis are usually seen on the heart and kidneys also. The brain is congested and show petechial hemorrhages. Brain, heart, all organs show petechial hemorrhages, ecchymosis. Injury to the hyoid bone is not common because the ligature is below the thyroid. That's not common. But sometimes fracture may occur in older persons. These older persons are weak, the bones are weak, so because of the movement of the neck, which can fracture. So by this you can conclude that in hanging, the most common fracture will be hyoid bone fracture. The hyoid bone fracture will be there if the age of the victim is more than 40 years, because before 40 years, the hyoid will be a cartilage, it will be elastic, so it will not get fractured easily. It will not get fractured. But if the Victim is of more than 40 years. The hyoid bone is ossified. The hyoid cartilage is ossified into bone, and there will be fracture of the hyoid bone. If we talk particularly which fracture in hanging, then it will be the superior horns, greater horns. That is great horns. Great horns will be involved in the fracture at the junction of inner two-third and outer one-third. Inner two-third, inner will be more, outer will be just one-third. Okay? Inner two-third, inner will be more, outer will be just one-third. Okay, and strangulation hard bone fracture is rare because here in the strangulation it is at the lower side. Okay, fracture of the thyroid cartilage is more common, especially on one or both superior horns. So one or both superior horns may be fractured of the thyroid. Thyroid fracture is common in strangulation. Hyoid bone fracture is common in hanging, because in the hanging the ligature is like near to the mandible. That's why salivation all will be there. Okay, the salivation will be there, stimulation of the salivation. So superior horns of the thyroid may be fractured in hanging, may be fractured, but it is most commonly seen in strangulation. Fracture of the thyroid, especially one or both superior horns. Fracture of thyroid lamina and cricoid cartilage is less common. Lamina and cricoid is less common. It occurs only when considerable force is used, or if some solid object is included in the ligature and applied over the front of the neck. Trachea is rarely broken. It's cartilage, so it's rarely broken. Okay, medical legal questions. Whether death was caused by strangulation. How will you do this? In death due to strangulation, the general features of asphyxia death are the local distribution in the head, neck is strongly presumptive for strangulation. This is confirmed by the ligature mark on the neck. Evidence of violent compression or constriction of the neck during life is obtained in the presence of bruising, ecchymosis above the marks on the neck, because there will be some nail marks will be present on the neck because the victim will try to remove the ligature. Hemorrhages in the strap muscles. Hemorrhages in the strap muscles, under the skin, in the sides of the tissues, on the trachea, larynx, and the laryngeal structure changes. Case of putrefaction, a medical opinion about strangulation can be given fairly. There are signs of mechanical violence applied to the neck. Example, fracture of larynx, horn, bone. Whether the strangulation was suicidal, homicidal, or accidental. Suicidal strangulation is very rare. How it's possible is actually not possible because a greater force is required. Whereas in hanging, it's easy. The suspension weight of the body will cause the constriction. Strangulation is difficult. Various methods of tightening the ligature employed by the victims. The ligature is tightened by a tourniquet. Tourniquet is then to take out the blood sample. The tourniquet is applied above the vein. Okay? But the person can apply a single or double knot before conscious is lost. So the person will try to strangulate. The person will get unconscious and again he will lose. He will not die. Just get unconscious, lose the power, again after some time he will wake up. Okay. Several turns of rope are tied around the neck with a knot which is usually single and in front or at the side or back of the neck. Cord may be tied around the neck and twisted tightly by means of stick or some other solid material used as a lever. The cord may be tied around the neck, twisted tightly by means of stick or some other solid material which is used as a lever. So, various methods they will try, but they will not get successful. Consciousness is lost. Something happened to my neck, to my voice box. Okay, well, hmm. So, when consciousness is lost or the grip on stick is released, the ligature will not become loose, gets arrested against the shoulder or chin. A running noose is applied to the neck and the free end of the rope to which a weight is attached is thrown over the end of the bed to which the victim lies. A person may strangle himself by leaning with the whole weight of his body on a cord passed around the neck and attached to a fixed point. In all cases of suicidal strangulation, nature should be found in situ and the body should not show signs of violence or marks of struggle. If signs of violence is not there, if signs of marks of struggle is not there, one can say it was a suicidal strangulation. The victim will have, a, a different scenario there. Trying to strangulate, tie the rope or cord with a stick to do as a lever, or free end of the rope, bait is attached, something like that. Okay, homicidal strangulation. So sometimes scene of crime is also of significance. Homicidal strangulation. Strangulation is a common form of murder. Virtually all cases of strangulation are homicide. Many of the victims are adult women, and frequently strangulation is then associated with sexual assault. Usually, there is a single turn of ligature around the neck with one or more knots, granny or leaf knots, at the front or side of the neck. There are two or more firm knots, each on separate turns of the ligature. Homicide is almost certain. Abrasions are usually seen due to movement of the ligature across the neck. The mark may be either completely encircle the neck or may be seen only at the front. The ligature is pulled tightly from behind. The mark may be also be sloping. The ligature is pulled upwards from behind and the position is high up at the level of the hyoid bone. Sometimes a ligature is passed over the body and then tied to the hands and feet to stimulate it. Okay. Such cases, the manner of tying should be examined. When ligature is passed over the body and then tied to hands, feet to stimulate the ritual suicide. But you have to see the manner of tying. The presence of a complex type of knotting in the cord. Example, the presence of reef knots in the strenuous strangulation. Evidences of struggle are usually found good. The person is taken unawares and the ligature is suddenly placed around the neck and pulled tightly. The person loses consciousness quickly and is unable to offer much resistance. Sometimes circumstantial evidence such as time, place, locked doors and windows, motive, etc. So almost the only evidence suggests that it is either suicide or homicide. Accidental strangulation. Children may get entangled in ropes during play, or the neck may be caught in window cords, etc. Infants are sometimes strangled in their cots when the neck is caught inside bars, restraints, braces, etc. Restrainers, braces, etc. Persons under the influence of alcohol, epileptics, and imbeciles may be strangled either by a tight scarf or collar around the neck. It may occur if an intoxicated person resists the neck against a bar or the hard object. It may occur when a string used in spending a weight on back slips from the across the forehead and compresses the neck. Accidental strangling may occur in uterus when the movement of fetus causes the umbilical cord to encircle the neck. So during pregnancy, sometimes I might have heard the umbilical cord may strangulate the fetus, strangulate the baby inside the uterus, and in which there is a stillbirth. It's very painful for the mother to see because of the true knot, because of the true knot, because of the strangulation, the fetus may die because of the umbilical cord. Ligature marks produced after death do not show bruising. Ligature marks produced after death do not show bruising. So ligature marks which are produced after death, the person is dead, then it was strangulated to suicide or something. Then bruising is not there. Either a grooved impression is seen on the skin which is not injured, a yellow or brown abrasion without signs of vital reaction. The vital reaction is not noted. Throttling or manual strangulation, this you might have seen in the movies, TV serials, very common. Here, with the help of human hand, asphyxia is done because of compression of neck. Death occurs due to occlusion of carotid arteries or vagal inhibition, which is much more common than in ligature strangulation, hanging accepted. Postmortem appearance external neck injuries. You can see the ideal position of the assailant and the victim, the manner of grasping the neck, the degree of pressure exerted upon the throat. The bruises are produced by the tips or the pads of the fingers. The tips or the pads of the fingers, okay? The shapes may be oval or round and of size of the digits, but continued bleeding into confused area usually increase in size. A grip from right hand from the front produces a thumb impression on the right side of the victim. Right hand from the front produces a thumb impression on the right side of the victim neck, which is usually under the lower jaw and the corner of thyroid. Several finger marks are seen on the left side of the neck obliquely downward and outward, and one below the other, but sometimes are ground together and cannot be distinguished separately. In a grip from behind the victim, the pressure is applied all round the neck, but some areas of bruising are more prominent due to pressure of the fingertips. When both hands are used to compress the throat, thumb mark of one hand and the finger marks of other hand are usually found on either side of the throat. Sometimes both thumb marks are found on one side and several finger marks on the opposite side. So a grip from both hands, one being applied to the front and another to the back. This is the bruises on the front and back of the neck. Due to the shifting of the grip, sometimes the frank struggle of victim, bruises may be seen in a completely haphazard manner. And the bruises are soft and red. After several hours, they appear brown, dry, and parchment-like. Fingernail abrasions, that there are two types. The brush is static, regularly curved, crescentic, comma-like, dash-like, or straight up to 1.5 centimeter in length and a few millimeters in width. So this is from the book Narayan Reddy. This is very extensive. Everything is given very extensively. So I don't think so I can complete this book. It's so extensive. So just brush up the topic because each and everything in detail is not possible. Signs of asphyxia. Face is usually consists of cyanotic above site of throttling with particular conjunctiva and sclera. Fine petechial may be present on the face. The tongue may or may not be bitten but is usually protruding. Mark of struggle and stir appearances which is similar to those of strangulation consist of asphyxia signs appear in 15 to 30 seconds pressure on the neck. But if a change in grip occurs and fingers imping on carotid reflex, cardiac arrest occurs, so that the intensity of congestive changes may be of any degree in any given depth. Bruising may not be seen if soft materials can between the hands and throat. Neck depression to obtain a bloodless feed in the neck. The abdomen thoracic organs should be removed, the head open and the brain removed, and the head is moved slowly up and down, allowed to drain of blood. The neck structure should be dissected in situ. Internal soft tissue of the neck are compressed and forced upwards and backwards against the cervical. The bruises may be found in deep layers of the skin, superficial and deep fascia, and the sheaths of the muscles, and in the substance of the thyroid gland. The bruises are usually separate and usually the muscles are involved. In some cases, bruising may be absent externally, although the deeper tissues may show fairly extensive bruising. Deep hemorrhages may be present in the base of tongue, usually at the side. Deep congestion is seen in central or whole posterior part of tongue. The marks on the surface of the neck may not exactly correspond with the internal bruising because of mobility of the skin. Also, especially the sternomastoid muscle may be torn. The intima of cartilage show rupture cases, 15% cases that are near the cartilage. Pulmonary edema may be present. Fractures, the larynx is usually squeezed and fractures are common, especially in old persons, calcified cartilages. Fracture of the superior corner of the thyroid cartilage at its base is common. Often only the right horn may be broken to which thumb was applied. Hyoid bone fracture, this can be classified into inward compression fractures, okay, anterior-posterior compression fractures, avulsion fractures. Avulsion is they occur due to muscular overactivity without there being direct injury to the hyoid bone. They are also called tug or traction fractures. Because this hyoid bone is the hanging bone, it is attached to the muscles. So because of that overactivity of muscles without there being direct injury to the hyoid bone, they are also called tug or traction fractures may be there. Anteroposterior compression fractures, in cases of hanging, the hyoid bone is forced directly backwards, to which the divergence of greater horns is increased, which may fracture with outward displacement of the posterior. Small fragment outward displacement is there. In such cases, the periosteum is torn on the inner side of the fracture only. Fracture may occur either in the greater horn or at its junction with body, and it may be bilateral. Outward fractures of greater horn or hyoid bone is ligature strangulations, run over, motor vehicle accident, blow on the front of the neck. So here, from inside to outside, the fracture will be there. In inward compression fractures, that is from outside to inside, moving towards inside. The fingers of the grasping hand squeeze the greater horns towards each other, due to which the bone may be fractured and the posterior fragment is displaced inward. Periosteum is torn on the outer side of the bone, but not on the inner side. Okay, what is the medical legal importance of this? Medical legal importance. What can be the medical legal importance? Medical legal importance is that in throttling means that is hand strangulation with the hand strangulation, manual strangulation. The usual diagnostic signs of the death due to manual strangulation are cutaneous bruising and abrasion, extensive bruising with or without rupture of neck muscles, congestion of tissue at the above and above the level of compression, fracture of larynx, thyroid cartilage, hyoid bone. Cricoid cartilage is most exclusively fractured in throttling. So here, cricoid cartilage is most extensively fractured. General signs of asphyxia. Suicidal throttling is not possible. Homicidal throttling is a common mode of homicide because the hair is immediately available. No need to search for a ligature or cord or wire or any material to strangle it. There is a method of choice in infants. The victims are usually infants, children, or women. Adults can be throttled then when under the influence of drugs or drink or stunned or taken unawares. If adults are throttled means the person was unconscious or the person was in influence of alcohol or drug. In an adult, signs of struggle are usually present, but if throat is forcibly grasped suddenly, so that's killing a child with this method is very common. If confusion. So, in an adult, signs of struggle are usually present, but if the throat is forcibly grasped suddenly and firmly, completely the victim cannot struggle. Sometimes it is preceded by revertebrated. The victim may have been restrained by the throat during intercourse and throttled to stop her cries. Okay, to stop the cries, they will throttle the victim. If confusion fingernail abrasions present on the neck, the presumption must be homicide. Accidental throttling, a sudden application of one or both hands on other person's throat as a demonstration of affection, in joke as a part of physiological filming, etc., may cause death from cardiac inhibition. What is garroting? The victim is attacked from behind without warning. The throat may be grasped by ligature, is thrown over the neck and quickly tightened by twisting it with a lever. Spanish iron garrotings were there. They used to tighten the iron collar by a screw, and this method is usually used in lonely places to kill travelers and to rob them. An iron collar tightened by a screw for strangulation. The mode of execution was once employed in Spain. What is mugging? Strangulation is caused by holding the neck of the victim in the bend of the elbow. The pressure is exerted either on the front of the larynx or at or both sides of the neck by the forearm and upper arm. So mugging is by arm itself. Okay, Banstola. One strong bamboo or stick is placed across the back of the neck and another across the front. Both the ends are tightened by a rope due to which the victim is squeezed to death. So Banstola here, Bans means bamboo. Hindi Bans means bamboo. So Banstola, what happens here? One bamboo is kept at the neck and one bamboo back of the neck and one bamboo at the front, and both ends have to be tightened. It can be tightened by the assaultant by standing and keeping one leg at one side, other leg on the other side, so that because of the pressure the victim dies. Other is by tying the ropes. Because of the pressure, the victim will die. So if a stick or foot is used, a bruise is seen in the center of the neck across the width corresponding to the width of the senses. So two sticks are used in front and back, both sides, and marks can be seen. Sometimes chest can be squeezed. One bamboo behind the chest, one bamboo front of the chest, and it is compressed. Compression of the neck. This is a broad term used for non-specific causes of neck compression which may be sudden. In hard compressions, the stamping or jumping on the neck or karate chops and flying kicks, soft tissue are grossly damaged. Last topic, like the most important, the broad topics, hanging, strangulation, cover. Now coming to suffocation, smothering, choking.